Hi, my name is Danae Narvaza, and I'm a pelvic floor physical therapist here at Pelvic Health and Rehabilitation Center. Today, I'm going to be talking about some foam roll exercises that you can do to help optimize your pelvic floor and the muscles adjacent to it. Today, I'll be using the IntelliRoll. So the IntelliRoll is a specific foam roller. You do not have to be restricted to this specific foam roll brand. You can try these exercises with any foam roller that you already have at home, or if you're interested, you could look into the IntelliRoll. I like it because there's certain concavities and indentations that help with some of these specific exercises that I like. So first, before we get down to the floor and start rolling, one of the exercises I really like the IntelliRoll for is thoracic extension. So this helps with some rib mobility as well as back mobility. So some landmarks that I want you to think about is this mid-back portion for individuals who wear bras. One thing that you could think of is, where is my bra strap? So over here, and then upper shoulder blade area here. So like not neck, but like right below here. So what you're going to do is perpendicular to your spine, you're going to bring the foam roller there, and you're going to keep your tailbone tucked. So if you're a sad dog, keeping your tail tucked between your legs. And then you're going to keep your knees bent. So don't leave your legs flat like that. Next, you're going to support your neck with your hands. And I want you to think of any part of your spine that is above the IntelliRoll. That is what's going to hinge backwards, like such. Meanwhile, anything below the IntelliRoll, so towards your feet, is going to stay still. You're going to stay here for a few seconds, maybe 10 seconds, and then go back up. Roll just a little bit, like maybe not even a full inch, to get to the next vertebrae, and then slowly bring yourself back down again. You're going to do this a few more times until you get to that upper in between the shoulder blades area, but not to your cervical spine or not to your neck. And you could repeat on the way down too. All right, the next one is the QL muscle. The QL muscle is this low back muscle over here. It anchors from rib cage down over to the top of the pelvis. So what I like about these grooves is you could try to aim for this area for that QL. So I'm going to lay partially on my side and anchor like such. I could roll forward and back a little bit to get into that groove. I'm using this leg to really push myself into the foam roller. So a lot of people, when they foam roll, they think back and forth is the way to go. But I would use rolling back and forth to kind of find that tender spot. And once you find that tight and tender area, you just stay there and then allow yourself to breathe and really rest into that spot. It helps with communicating with the nervous system of, okay, this is a uncomfortable area, but I am safe. I don't need to guard. I can go ahead and relax the soft tissue in this area and release with a myofascial trigger point release. Okay, so you could do that on the other side, but I'm going to go ahead and go over the next muscle. So the next muscle that we can do is the hip flexor or iliopsoas muscle. So again, I like the concavity of this and the convexity here, because then I could place it into that muscle. To find that muscle, you're going to look for the belly button and kind of this pelvic bone here, and you're going to go in between. So I'm placing the foam roller here. Next, what you're going to do is you're going to keep that landmark, and you're going to lay yourself down. And then up to you, you could keep your legs straight, like such. And you're just going to rest and try to relax your belly into the foam roller as it slowly impales you. But again, like communicating with your nervous system, trying to not guard, trying to do your diaphragmatic breathing to help communicate, okay, this stimulus to my body, it's not dangerous, it's not a threat. Can I relax these soft tissue muscles? And if you want to get crazy with it and add a little bit of more noxious stimuli, you could bend the knee back and forth, or you could rotate in and out. Up to you. You could even rest on your forehead like such, whatever's more comfortable for you. Okay, now we're going to move on to a controversial group of foam rolling. So a lot of people say they like to foam roll their IT band, going back and forth on the side of the leg, but it's actually more efficacious to go on the specific muscle that attaches to the IT band, which is the tensor fascia lata. Sounds like a coffee drink, or you could just call it TFL for short. So that muscle is going to be on the side of your hip right here. And essentially what you're going to do is you're going to go on your side, and you could prop the opposite leg over to kind of help support you, and then stay supported on your elbow. And so some people would roll back and forth like such. But if you kind of go over to this area here, you'll find that it's quite tender. So I would suggest just staying here, and then you could even kind of rotate back and forth if you want to add that extra stimulus, or just stay there statically. So the IT band is actually quite fibrous and thick, that foam rolling doesn't quite change the state of the tissue. But if you feel like it's therapeutic for you to roll back and forth over the IT band, then go for it. All depends on you. So next we're going to go over the quads. So quad muscles are in the front over here. What's nice with the IntelliRoll, if you're adventurous, you can do both legs at the same time. If not, then you can go ahead and just do one at a time. But what I'm going to do is I'm going to go in like a plank position, like such, and I'm using my elbows to kind of roll me back and forth to find a tender spot. When I find a tender spot or tight area, I stay there a bit, and then I just do my diaphragmatic breathing. Similar to the other muscle area that I was working on earlier, you could add extra stimulus by activating and then stretching the said muscle that you're working on. So going into knee flexion and then straightening. Like such. And then rolling, finding another tight, tender spot, doing the same thing. And play around with it. So the quad is a very big muscle, or technically there's multiple muscles within that muscle group. So you could practice going a little bit off to the side, a little bit more inward, and finding any tight areas there. And again, if you are straining and having difficulty, maybe a massage stick or a Theragun is a better option for you. Okay, so the next one we're going to go over is the abductors. So the abductors is the inner thigh over here, and this is where some people get tripped up a bit in terms of how do they foam roll that area. So it's going to be similar to the quads, except now we're going to have one of the legs propped up to help you get access to that inner thigh. So I will show you with my left leg first, or I'll show you with my right. It's closer to you. So I'm straightening my left leg, and then this right leg is going to go out to the side like such. And I'm rolling side to side, left to right, until I find a tight area. And then when I find the tight area, I stay there, do my diaphragmatic breathing, etc. Similar like the other muscles. If you want to add extra stimulus, you can lift back and forth. This is kind of nice because then you get to mobilize your rotating hip muscles. But if you're fine with just staying there, doing your breath work, that's okay too. Also, don't shy away from going very close to the groin. The adductor muscles attach really, really close to that pelvic bone, all the way to that pubic symphysis. So don't be afraid to roll very, very close to your groin area. And then you could repeat that on the other side. Next, I'm going to go over how to roll your gluteal muscles. So with a foam roller, I like to go into like a figure 4 stretch, because then I'm stretching my muscle plus getting soft tissue massage to it too. So if I'm working on my right, I'm going to go into this figure 4. I'm going to roll over onto the foam roller, look for a tender spot. So notice how I'm kind of torquing myself to the side, back and forth, so I find a tender spot that's tight, and then I stay there for a bit, allowing myself to breathe. You might go up and down. Again, glute muscles, also a large muscle group, so you might be spending extra time in different areas. But again, I really like finding the tight and tender spots and then spending extra time in the more involved areas rather than just going back and forth, back and forth, back and forth. Okay, and then you could repeat that on the other side. So go ahead and try those foam rolling exercises. And if you have any questions or concerns about if this is appropriate for you or if you are performing these exercises correctly, ask your therapist to see if this is right for you. Thanks for watching.